Greetings to all. My topic is about Klebsella pneumoniae. General characteristic of Klebsella pneumonia: grams classification, gram negative, shape, rod shape, bacillus, motility, non-motile, capsule, present, endospores or absent, respiration, aerobic, facultative, anaerobic, optimum temperature 35 degrees Celsius to 37 degrees Celsius, optimum pH is 7.2. In recent years, Klebsiella have become important pathogen in nosocomial infection habitat. Klebsiella is a common opportunistic pathogen from human and present particular in the gastrointestinal tract. Other habitat include sewage, drinking water, industrial influence, and vegetation. Classification of Klebsiella pneumonia K1 serotype and K2 serotype. The genus Klebsiella, named for German physician and bacteriologist Edwin Klebs, who was assistant of Rudolf Virchow, well known for the cell theory and discovered corneobacteria diphtheria also. Klebsiella pneumonia is also called as Ferdinand's bacillus, was the first described in 1882 by Karl Ferdinand, German microbiologist and pathologist. Pathogenicity of Klebsiella pneumonia. Disease transmission. Klebsiella pneumonia can be spread through person-to-person contact by the contaminated hands of healthcare personnel or other person. Klebsiella pneumonia less commonly transmitted by contamination of environment. Klebsiella is spread very easily and rapidly, but not through the air. Incubation period 1 to 6 weeks. Virulence factors of Klebsiella pneumonia: flagella, motility, cell wall receptor, and fimbriae. Capsular polysaccharide cause sepsis. Antiphagocytic resistance, complement mediated killing. Lipopolysaccharide endotoxin cause sepsis. Antiphagocytic resistance, complemented mediated killing. Capsular antigen antiphagocytic inhibit macrophage. Aerobactin siderophore like ion chelating agents. Pathogenesis of Klebsiella pneumonia. Klebsiella pneumonia is pathogenic and is responsible for a large number of infections every year. Capsular polysaccharide, lipopolysaccharide, and capsular antigens are the common virulence factor of Klebsiella pneumonia. The main virulence factor in pathogenic Klebsiella pneumonia strains is aerobactin, produced by K1 and K2 serotypes, which is also the main virulence factors. Common symptoms of Klebsiella pneumonia infection in the blood include fever, chill, rash, and light headedness, faintness, or dizziness. Infection in lungs can lead to pneumonia and can result in breathing problems. Most common treatment for Klebsiella pneumonia infection are antibiotics, but recent strains have been found to resist many common antibiotics. In recent study, hypervirulent strains were responsible for deaths. Clinical disease caused by Klebsiella pneumonia. Klebsiella pneumonia often cause bacterial pneumonia or infection of the lungs. Pneumonia happens when the bacteria enter your respiratory tract. Symptoms of pneumonia include fever, chills, cough, yellow or bloody mucus, breathing trouble, and chest pain. Urinary tract infection (UTIs) don't always cause symptoms. If you don't have symptoms, you might experience a frequent urge to urine, pain and burning when urinating, bloody or cloudy urine, discomfort in lower abdomen. Urinary tract infection in kidney might have fever, chills, nausea, vomiting, pain in upper back and side. Skin or soft tissue infection. If Klebsiella pneumonia enters through break in it can infect your skin or soft tissue. Usually this happens with wounds caused by injury or surgery. Klebsiella pneumonia wound infection includes fever, redness, swelling, cellulitis, swollen and red skin, necrotizing fascist flesh-eating disease, and myositis, inflammation of muscles. Meningitis. Klebsella pneumonia can cause bacterial meningitis or inflammation of the membranes that covers the brain and spinal cord. Meningitis happens when bacteria infect the fluid around the brain and spinal cord. Symptoms of meningitis are high fever, headache, stiff neck, nausea, vomiting, photophobia, and confusion. Endophthalmitis. Klebsiella pneumonia is in the blood. It can spread to the eye and cause endophthalmitis. Endophthalmitis is an infection that causes inflammation in the white of eye. Symptoms of endophthalmitis include eye pain, redness, white or yellow discharge, white cloudiness on the cornea, photophobia, and blurred version. Pathogenic liver abscess. Often Klebsiella pneumonia infects the liver. This can cause a pyogenic liver abscess or a pus-filled lesion. Klebsiella pneumonia liver abscesses commonly affect people with diabetes or who have been taking antibiotics for a long time. Common symptoms including fever, pain in the right upper abdomen, nausea, vomiting, and diarrhea. Bacteremia. In primary bacteremia, Klebsiella pneumonia directly infect the bloodstream. In secondary bacteremia, Klebsiella pneumonia spread from blood to all parts of the body. Symptoms of bacteremia are fever, chills, and shaking. Bacteremia needs to be treated immediately. If left untreated, bacteremia can become life-threatening. Laboratory diagnosis of Klebsiella pneumonia. Microscopic examination. Gram staining pink colored, gram negative rods, motility non-motile, negative capsule staining, unstained capsule under black stained background. Colony morphology on culture medium. Nutrient agar colonies are mucoid, circular 2 to 3 mm, dome shaped, grayish white, transparent to opaque colonies. Maconchi agar mucoid, pink colored colonies, fermenting colonies. Blood agar mucoid, non hemolytic colony, gamma hemolysis. Biochemical tests. Catalase test positive, oxidase test negative, urease test positive, indole test negative, methyl red test negative, Voges Proscare VP test positive, citrate utilization test positive. And then TSI test acid but acid slant, no gas, and NOH2S production. Lysine decarboxyl test positive, cellulobiosis test positive, esculin hydrolyse test positive, acetate utilization test positive, ONPG test positive. Treatment and preventive measures. Klebsiella infection can be dangerous, so doctor started treatment with antibiotics right way. Examples include aminoglycosides, polymyxins, tagicillin, phosphomycin, and then tiomycin, cephalosporins, cephalotoxami, and ceftriaxone, crepnemus, impinephrine, or silastine. Maintenance of high hygienic standard will reduce the risk of infection. Thank you.